All right, welcome back to ABA exam review and the continuation of our BCBA exam practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A researcher evaluates two workplace productivity interventions, A and B, in a single case design. Intervention A runs first for 2 weeks, followed immediately by intervention B. Productivity increases under A, but remains about the same under B. However, the researcher questions whether the order of implementing A before B might have influenced the results. What is most likely affecting the results based on this information? Pretty straightforward question to start with. We're looking at what might be affecting the results given our information. What do we know? We know this researcher has two interventions, A and B, in a single case design. He first runs intervention A for 2 weeks. Let's call that A. And then he immediately goes to intervention B for another however long. Productivity increased under A and then remained about the same under B. So it was increased with A, but remained the same under B, not much change. The researcher, though, says the order A before B might have influenced the results. So when we think about the order of our conditions and the condition before the next condition affecting the outcome of the following condition, what are we referring to? A, attrition. Attrition means dropout. It's when you are losing participants in your study. That is not what is happening here. Attrition is not what we're concerned with, given what we know. B, sequence effects. Sequence effects is exactly what we're describing here. The sequence of the conditions are affecting one another or might be affecting one another. The researcher is concerned with, did A influence what B showed? In other words, maybe they learned, the participants, in A, and then when B was introduced, they already knew whatever the productivity intervention was, and it just continued with B. So the researcher is worried that sequence effects are affecting the results. C, maturation. Maturation has to do with our participants growing or getting older or learning as they just naturally, time passes. We're not worried about maturation of our participants given this information. We're worried about the sequence of the conditions that were presented. And then D, cost benefit analyses. Cost benefit analyses is a strategy. The researcher is not conducting a cost benefit analysis, so it should not be considered. The issue here is most likely sequence effects. The order of the conditions affected A affected B, given A came first. A clinical supervisor oversees 5 behavior technicians implementing interventions for multiple clients. The supervisor collects fidelity data on each technician's performance, tracking correct prompt usage, accurate data collection, and appropriate reinforcement delivery. The supervisor notices some technicians excel at prompt fading while others struggle. In a scheduled feedback session, the supervisor must address individualized performance gaps. Which practice represents the most effective way for the supervisor to provide data-based feedback to the technicians? So it's a long question, but we're never panicking at long questions because we're going to approach each long question the same way we do any other question. We're not jumping right to the answer choices. We're attacking and understanding what the question is giving us. Question wants to know, what is the most effective way for the supervisor to provide database feedback? So if we have a clinical supervisor, they're looking at 5 technicians and implementation, and they're tracking a variety of different things: prompt usage, data collection, reinforcement delivery. Then the technicians are all different, as most technicians are. Some are going to be better at other things. Some are going to be worse at other things. We have to give feedback individualized to each technician, but if we're in this feedback session together, we've got to do it in a way that's productive. So how would you approach this situation? A, deliver only general praise for team effort, avoiding specifics so no one feels singled out. This is the nice way to go about it. But is it going to be effective at making your technicians better? Not if you're giving general praise. We already know some of these technicians are better at some things than others, while worse at other things. You've got to take that data you collected and use it in your feedback to give that individualized, corrective, constructive criticism. B, present a comparative chart ranking all technicians from best to worst, emphasizing competition to improve. B goes the other way. Yes, now everyone knows where they stand, but now you've pitted them against each other. We're supposed to be a team. You don't want to sow discontent amongst your team. C, offer behavior-specific feedback tied to each technician's fidelity data, highlight strengths, and give precise guidance for improvement with opportunities for questions and practice. C should be the obvious answer. And this is a good example of the question is long, the answer choices are long, but it can still be a very simple question because we attacked the question and we slowly worked our way through it. Our only goal is to get each question right. It's not to go quick. It's not to try to finish the test in 2 hours. It's to get each question we attempt correct. And then D, email a summary of the performance on average to each technician stating good job overall. D, again, does not address the need for individualized feedback. All of our training needs to be based on individualized, personalized instruction, just like we would do for our clients. So what should happen here? Behavior-specific feedback tied to the data, highlighting strengths and giving precise guidance for improvement with opportunities for questions in practice. You assign a behavior technician to measure how often a client independently initiates a social greeting within a community skills program. The technician marks down each greeting over a 2-hour period to see if there's an increase or decrease in greeting behavior. Which measurement procedure did you most likely assign to the technician to record greetings? All right, let's think about this. It's a measurement question, and it's a procedure that you assigned to the technician. Our behavior is greetings, and you want the technician to measure how often the greeting is independently initiated. Now, we know that the technician marked down every greeting, each greeting, over a 2-hour period. So first, let's start there. If we have a length of time and every single instance of a behavior is recorded over that time span, and we're not using sampling, we're not using intervals, we know it's going to be a continuous measurement procedure. So if we look at our answer choices, C and D, we can't pick C and D because those are discontinuous. Those are time sampling, they use intervals. We're not going to use those if we're measuring continuously. So that leaves us with event recording and duration. Duration, we're measuring a length of time. Event recording is like frequency. We're measuring how many. And so if you want to know how often someone is initiating a social greeting, you're going to count how many times it occurs, right? We're not measuring how long something is happening. We're measuring how often. So to do that, you're going to be using a event recording, or in this case, you've assigned the technician an event recording procedure. Samuel taught a new exercise routine to a group of clients over several weeks. Initially, Samuel provided immediate feedback and praise for correct form after every repetition. Once the clients mastered the routine, Samuel gradually thinned the reinforcement schedule, but he still checked in periodically to reinforce correct form. The clients continued performing the exercise routine correctly long after the intensive training ended. What strategy best describes Samuel's efforts given the outcome? Now, we're looking at what kind of strategy Samuel was attempting. And the key here, and it's why we attack the question, because if you read this, the clients continued performing the exercise routine correctly after intensive training ended. Immediately, you should think maintenance. Maintenance occurs when the behavior continues after training is over. Now, we also know that Samuel provided or was providing immediate feedback and praise after every repetition, so a very thick reinforcement schedule. When it was mastered, Samuel thinned the reinforcement schedule and just checked in periodically. So essentially, he was doing maintenance checks. So based on this information and what the clients did and the outcomes, what was Samuel doing? Well, he was A, planning for maintenance. If you think about B, planning for generalization, maintenance is actually a subset of generalization. But when we're trying to distinguish between the two, generalization refers much more to the idea of teaching something and that something happening in a different environment or in different context where we're generalizing, right? In this case, it's not so much about the routine happening somewhere else or in a different context, but it's more about the routine continuing and maintaining after training is over. So we're much more planning for maintenance rather than generalization. We're just trying to be specific. And then C, differential reinforcement of other behaviors. Well, Samuel is not reinforcing for a behavior not happening, so it can't be a DRO. And then D, differential reinforcement of higher rates of behaviors. Samuel isn't setting a criterion and then reinforcing for hitting or going over that criterion, so it can't be D either. Given what we know, Samuel's strategy or efforts look like planning for maintenance. As behavior analysts, we do not wait or hope for generalization. Instead, we plan for generalization. One way to plan for generalization is through multiple exemplar training. What is another term used for multiple exemplar training? We've done some long questions, so I wanted to end on just kind of a learning question, right? Because this has come up before. When we think about multiple exemplar training, what are we trying to do? We're trying to teach a lot of examples, right? We want to teach as many examples as possible so we can try to cover as many scenarios that might happen in a generalized setting. So if that's our goal, what is another term used for multiple exemplar training? A, train loosely. When we're training loosely, we're just varying non-critical aspects of the environment. It's not necessarily trying to teach a bunch of examples. If you look at B, though, teach enough examples is exactly what we're doing with multiple exemplar training. These are referred as essentially the same thing. C, indiscriminable contingencies. With indiscriminable contingencies, where the learner, for example, doesn't know when reinforcement is coming or why. And then D, programming common stimuli. This is when we're actually handpicking certain stimuli to use in training because we believe they might be happening or will happen in the generalized setting. The difference is with multiple exemplar training, you're just trying to produce a bunch of different examples. Programming common stimuli, you're trying to be much more specific about what you're teaching and what you're teaching with. Thanks for watching. Some difficult questions this time around, so hopefully you did well. Either way, let's keep working hard, keep studying hard. Be sure to subscribe. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.